Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So we continue with part 2 SOCSO. Now let us concentrate and pay attention on coverage under Employment Injury Scheme. So there are 4 situations when employees is covered and categorized under EIS, Employment Injury Scheme. The first one is industrial accident, commuting accidents, accident during emergency, and occupational disease. So this situation must be related to work. So I also mentioned here work-related injury or disease and anything derived from your occupation. The first one is industrial accidents. This is the accident that happened at workplace. It could be, for example, like if you fall because of the slippery floor, tank, or something like that. If you work in construction, for example, maybe something like bricks fall from above level that hit your head. Yeah. You may cut your fingers if you work at factory or restaurant. Yeah. So it is usually covered for serious injury. The second one is commuting accident. This is in the case of accident happen when you travel from your home to your workplace or come back from workplace to your home. Yeah, it is also in the case of if you travel from home to your workplace and to any place related to work. Example, to go to site visit, to hotel for meeting, seminar, appointment, and etc. It is also covered if you go out for meal, but this one must be within what we call reasonable radar nearby at your area. Yeah, so but you have to make sure there is no diversion of your traveling route. When I mention about routine traveling route, it is very important for me to illustrate some example here. So if you refer to this slide, you can see the pictures. Yeah, for example, if you travel from home to your workplace, definitely you will be covered under commuting accidents. So this is one way. And if you travel from workplace back to your home, this is also considered as commuting accident. But in the case of, when I mentioned about routine traveling route, if this is a routine for you every day, that on your way to work, yeah, you drop by to school to drop your children at school, and then you come back to the what we call the main road and then going to workplace. So that is also considered as routine traveling route. And for example, there's also a routine for you to after you drop by your children at school and then you drop by your wife at factory where your wife is working, then it's also considered as a routine. Yeah, that's one way. Yeah? The second thing is, for example, if you from your workplace you are assigned by your immediate boss, for example, to go and to attend meeting, seminar, discussion at hotel, and then the traveling route between your workplace to hotel also considered as a commuting accident. Yeah, in the case of recess hour, if you like to go for lunch, yeah, but only for permittable and reasonable what we call hours. Yeah, so if you go to food court nearby to your area, that one also can be considered as traveling or commuting accident. Yeah, in the same time, for example, if you also assign and this is your responsibility to go to your construction site. Yeah, if you work in construction company, so you're traveling from your home to your construction site, or either from your workplace to the construction site, this is also considered as the commuting accident. But you must remember this must be related to work, provided there is an instruction from your employer. And for example, like for food court, it must be reasonable. Yeah, for example, if you live in Seremban 3, the reasonable food court area is only nearby in Rasa, Mambau, or maybe the farthest is Seremban 2. Yeah, but you cannot go for lunch at Port Dickson or very far from Seremban tu, ya, Kuala Pilah, jauh sangat tu. And at the same time, during on Friday, for example, for Muslim, so your traveling route from your workplace to mosque also can be considered as a traveling route. Yeah. Employment injury scheme also covered for situation when you are injured, when you are trying to rescue anyone, your friends, for example, your co-workers at your workplace in the case of emergency, for example, like fire, explosion, yeah, and it can also include the natural disaster, for example, like flood and etc. Fourth one, occupational disease. This is the situation when you get a serious disease which related to work. Yeah, for example, like you got asthma because of dusty environment at sawmill. Yeah, you become deaf because excessive noise at factory. You got cancer because you exposed to very polluted environment at the workplace, chemical, something like that. Yeah, now it evolved to work. For example, like body strain due to non-ergonomic workplace, furniture which led to tennis elbow and etc. So this is the new thing actually that they are going to cover, which specified under ILO. Yeah. Now we will focus on what type of benefits available under employment injury scheme. So you must look at on a very important note here. Awareness on EIS is better because people know they are covered under SOCSO, especially when it comes to related to work. But what it is, yeah. So in this slide, yeah, you can find the coverage, qualifying condition, and procedures to follow when you want to claim. Yeah. So for example, like in a red, this is the what we call the medical benefits. Yeah, this is the medical benefits. So for example, like this is to cover any injuries or occupational disease, so you can get the treatment from SOCSO panel clinic, a government hospital and clinic. And if you go a serious injury, you can what call hospitalized at the nearest government hospital and entitled for second class ward inpatient. I'm not going to read what we call the qualifying condition and the procedures. That one you can read by yourself. Yeah, but again, for in the red box, treatment should be continued until you are recovered, and then it is free, which the cost will be covered by SOCSO. This is the temporary disablement. Yeah, temporary disablement benefit is when is you are only entitled to get this temporary disablement benefit. Yeah, this is in form of compensation. Yeah, if in the case of you must got MC more than 4 days. Yeah, if you MC less than 4 days, you are only entitled for medical benefits. But if you got MC more than 4 days, you're unable to work for 4 days and above, then you are entitled to get this temporary disablement benefits. Then you will get compensation, yeah, with the rate in red box. Yeah, daily rate, yeah, a minimum of 30 ringgit and the maximum of 105 ringgit 33 cents per day. Yeah. This is permanent disablement benefits under second schedule. Yeah, it happened due to very serious injury or disease which led to inability to perform your duty. Yeah, so meaning to say, you also entitled to get after you receive temporary disablement benefits, you may entitled to get the permanent disablement benefits according to the condition. Yeah, so the degree or loss of disablement is classified in form of percentage, as you can see in your right side, in the box in your right side. Yeah, percentage of the loss, which is to be determined by SOCSO medical board. Yeah, so you may find the example of degree here. Yeah, so for example, like if you lost both hands or amputation at higher side, the percentage of loss is considered as 100%. Yeah, hand and foot 100%, loss of sight 100%. Yeah, if you loss of thumb only is considered of loss of 30%, but this still considered as the permanent disablement benefit. You meaning to say you are permanently disabled at certain part of your body part, for example. This slide to explain further details on permanent disablement benefits. Yeah, so this is in terms of how much you can get, subject to minimum and maximum calculation. For example, like if you loss of 100%, you can get 90% of your daily wages, and you calculate for 1 month. Yeah, loss of 20% or less, so you're going to get only lump sum payment. Yeah, so if you exceed 20%, this is another calculation. Yeah, so it is in form of cash. Yeah, so you get this compensation, you'll get your salary, in the same time you also get the permanent disablement benefits. Constant attendance allowance. in the case of 100% permanent disablement, which we have discussed before, previous slide, when you became paralyzed, for example, bedridden, you bedbound, yeah. So please refer to slide 11 just now. So you become very dependent, yeah, and you need to rely on someone 24/7, yeah, someone who can need to feed you, to bath you, and to look after you, yeah. So this amount, which apa tu, maximum of 500 ringgit, is at least you can pay, yeah, for home nursing, for example, or at least to your wife, children, or anyone who can take care of you. Okay, so this is a constant attendance allowance. This one is about rehabilitation benefits, yeah. Remember, it is only to be given for recipient of permanent disablement benefits, yeah, but considered likely to be cured, yeah. So rehab center will train you, so at least you can have skills, yeah. Maybe you might be able to return to work, yeah. So we're going to talk about return to work later, yeah. So it is a physical rehabilitation and also vocational rehabilitation. Dependence benefit, yeah, is another form of existence, scheme under EIS, yeah. So it is for the family members in the case of death of employees, also so members. So now is very generous, yeah. If you look at this what we call a slide, yeah. Previously so only covered for widow, but now widower also eligible to get the benefits, yeah. And previously the payment for widow is limited until she remarried, but now until she died, and also until the husband, the widower died, yeah. This one is slightly different with DPF, because in EPF you can nominate for the family members or the waris to get the benefits, but SOCSO benefit is only meant for the next of kin, yeah. So meaning to say, who is the next of kin? It is listed here, yeah? Widow, widower, children, parents, grandparents, brothers and sisters is followed accordingly, yeah, by ranking, yeah. If you have more than one wife, okay, please take note, yeah, or more wife from different and children from different wives, so then they have to share the portion accordingly, yeah. So this is the rate of how much you can receive, yeah. This one I think you can read by yourself, yeah. It's more to qualifying conditions and the procedures. Next, about funeral benefits, you also, if you receive EIS, okay, under employment injury scheme, yeah, so you also are entitled to get the funeral benefits. It is actually the amount of 1,500 ringgit, yeah, lump sum, yeah. This to be given to the next of kin who manage the funeral ceremony. This one, education benefits, yeah. Please take note, this is to be given for children of SOCSO members, yeah, in two conditions. The first one, in the case of death of SOCSO members, okay, and number two, if the the SOCSO member is actually 100% permanent disablement benefits recipient, yeah. And this is only for tertiary education. It comes in form of loan, and it can be transferable to scholarship subject to your result, yeah. Okay, that's all for part 2 so thank you.